Hi everyone, my name is Katie Eiler. I'm a registered nurse.
And my name is Allison Fox, and I'm a social worker. We're both health coaches here at Pullman Regional Hospital. We want to talk to you briefly about motivational interviewing. Maybe this is a term you've heard, but we bet you're wondering what it is exactly.
So what is motivational interviewing? It's a collaborative conversation style for strengthening a person's own motivation and commitment to change. It's arranging conversations so that people talk themselves into change versus us telling them what to do, based on their own values and interests.
Okay, but what does that mean? This is a way to help people change by putting the patient in charge, by listening, and by not confronting or telling them what to do. Because something we know is people don't like to be told what to do.
So how do we do it? We find out what is important to the person and use that to guide the conversation for change. We focus on the problems that the condition causes for them. So if we were speaking to someone who was overweight, we would ask them what's important to them. And if they said their children, we would focus in on that and ask them how their weight affects their children. And they might say something like, I can't play with them like I used to, or like I would want to be able to. And now they have come up with a reason to want to change that is personal to them and affects their own life.
Is this just the newest fad? No. Although the term is relatively new to most, it first came about in 1990. P.S. That was 30 years ago. It started in the field of addictions and has become widely used throughout medicine. It has been thoroughly researched and is evidence-based. So this is not just something that's going to go away. It's here to stay.
So why should you care about this? 85% of healthcare costs are attributed to health behaviors, meaning that they're preventable. 75% of healthcare dollars are spent on chronic conditions, and we know that most chronic conditions are preventable or reversible in the early stages. The US ranks highest in healthcare spending in the world, despite not having better outcomes. And perhaps the scariest statistic, for the first time in history, children will live shorter lives than their parents. So what we're doing isn't working. So what do we do?
Acute care model versus partnership model. Something we want you to think about is, this is not just a new technique, but a paradigm shift, a shift in the way of thinking. Right now, you get sick, you come to the hospital, we fix you up, tell you what to do or change, and then send you back out. What we're moving towards is a partnership model, which is patient-centered meaning instead of telling them what to do. We are having them tell us what they can do. So, how can we help keep them from getting sick in the first place? Even the sickest patients spend more time at home than here. So how can we best equip them to stay healthy and live their best lives at home?
This is an important topic that is transforming healthcare. And no matter what your role is in the healthcare setting, this is a vital tool. Thank you for watching. We hope you learned something. And we also hope that you'll join us for our trainings. Our first is June 10th at 10, and our second is June 11th at 2, and there will be more to come. See you there.